Assalamu alaikum. I'm Marwan Adel Ahmed. In this lecture, we'll talk about gynae history taking. In any history taking in medical school, we'll talk about first personal or geographical data, history of present illness. History will start with menstrual history, followed by past obstetric history. Then details of gynae history, past medical and surgical history, drug and family history, social history, and finally system inquiry. This history will be presented as summary. First, history taken will be in privacy and confidentiality. It's important to avoid medical language with patient. The medical professional will be systematic in history taking, asked at each consultation. The specific area of history should be then explored according to positive findings. It's important to a student or doctor to establish initial rapport with patient and put them at ease. The practitioner should introduce themselves by name and status and check the patient details, patient ID, and take permission for history taking. To start by person or demographic data, first the name of the patient to confirm its ID and for communication, age, address, educational level and occupation, marital status and duration, if married or divorced or widow, severity and last delivery interval. Ask about origin, nationality, and tribe, if possible. Special habits of medical importance like lifestyle, nutritional habits, smoking, and like that. Residence and distance from hospital, partner's details. Ask about name, age, and occupation relevant in subfertility patient. After patient data, we'll ask about main complaints that necessitate patient to present to doctor. Will be in a patient own words, ask about duration of symptoms. If the complaint contains many symptoms, sort them in chronological manner, oldest to newest symptom. The history of present illness, its details of presenting complaint or description of the problem. Ask about severity, duration, relation to menstrual cycle, aggravating and relieving factors, any previous investigation or diagnosis, treatment received, and review the system affected. Menstrual history, this will be explored in all patients except menopausal women. Menopause is defined as consecutive 12 months of amenorrhea or in surgical menopause following hysterectomy or oophorectomy. Okay, menstrual history, ask about menarche. Menarche defined as age of onset of first period. Ask about cycles frequency and duration. Cycle frequency represents the entire cycle length from the first day of the menstrual cycle to the first day of the next cycle, while cycle duration is the actual days of bleeding last. Normally, cycle frequency from 21 to 35 days and cycle duration 5 to 7 days. Also, we ask about last menstrual period to consider possibility of pregnancy. Ask about pattern of bleeding, its regular or irregular, amount of bleeding, any passage of clots, and number of pads used. This will explain if this average amount of bleeding or heavy menstrual bleeding. If the patient take any time off work, confined to the house, or feel symptoms of anemia following menstruation. Don't forget to ask about abnormal uterine bleeding. Menstrual cycle is a normal uterine bleeding, but abnormal uterine bleeding example of intermenstrual bleeding between two menstrual cycles, postcoital bleeding following sexual intercourse, and postmenopausal bleeding after diagnosis of menopause. The patient have vaginal bleeding. This is the postmenopausal bleeding. Ask about dysmenorrhea and mid-cycle pain. Mid-cycle pain is ovulatory pain, and dysmenorrhea is pain associated with menstrual cycle. Other pain, example, dyspareunia with painful sexual intercourse, If the patient menopaused, ask about the age at menopause, postmenopausal bleeding, and if the patient used heart hormone replacement therapy. Menopausal symptoms like hot flush, sleep disturbance, emotional psychological difficulty, sexual difficulty due to dryness, vaginal dryness, and bladder symptoms. In obstetric history, if the patient had been previously pregnant, ask about details of each pregnancy and the duration from the last delivery. All pregnancies must be recorded, including successful ones, to term, miscarriage pregnancy, ectopic, and termination of pregnancy, molar pregnancies. In details, ask about outcome of each pregnancy, gestation, and mode of delivery, any complication, the outcome, gender, birth weight, inter-pregnancy interval, and the current alive children. Explain about future fertility intentions, which will affect the treatment options. Sexual history is a part of gyne history. It's relevant in cases of infertility and sexual transmitted disease. Also in genital prolapse, this sexual history taken should be professional and non-judgmental way. Ask about number and gender of present partners or partner, sexual transmitted infection previously, or pelvic inflammatory disease history. Ask about history of contraception, which method used currently and in the past. In abnormal vaginal discharge, we'll ask about amount, color, odor, and consistency of that discharge. Ask about postcoital bleeding and dyspareunia. Vaginal and perineal discomfort or itching or vulval skin lesions. Other gynecological symptoms, ask about irregular bleeding, heavy menstrual bleeding, intermenstrual bleeding, postcoital bleeding, as we say. Ask about any pelvic pain related to menstrual cycle or not related. Related to menstrual cycle, it's dysmenorrhea. If related to sexual intercourse, it's dyspareunia. Ask about any fertility problems or induced pregnancies, any problem with continence, urine incontinence, or fecal incontinence. Any dyspareunia or sexual difficulty, any vaginal discharge, as we say, we'll ask about duration, volume, color, consistency, and smell. Vulvar skin change or itching, menopausal history if menopaused, and ask about heart use. Cervical screening program is the screening method to all patients above 25 years up to 64 years. It's usually every 3 to 5 years according to the age of the patient. It's targeted to detect human papillomavirus, which is precancerous infection to the cervix. Ask about the date of last smear, its outcome, and any previous abnormalities, what's the diagnosis, and if the patient received treatment or not. In previous gynecological history, ask about any other gyne conditions, example endometriosis, fibroid, PCO, polycystic ovaries. Ask about previous gyne surgeries, example hysterectomy, removal of uterus, cystectomy, removal of ovarian cyst, oophorectomy, removal of the ovaries, salpingotomy or salpingectomy. Salpingectomy is removal of uterine fallopian tube, or simply biopsy. In any previous surgery, don't forget to ask about date, indication, and any possible complication. As we say, ask about the date of last smear and its result, whether they always normal or there is abnormality. Also in gyne history, we ask about breast screening. Breast screening program is a screening method also targeting high-risk population from 50 to 70 years every 1 to 3 years. High-risk population if there is a family history of breast cancer or family history of BRCA gene mutation. The method of screening using mammogram. Previous medical history, any chronic disease, surgical operations, in dates. Medication and allergies, ask about chronic medication, in allergy to medication or food. Regarding family history, in gynae, we'll ask about familial cancers mainly, which include breast, ovarian, endometrial, and colon cancers. Socioeconomic history, occupation of the husband, housing conditions, level of education and income, smoking and alcohol intake, special habits, home conditions and relationships, lifestyle issues such as recreational drugs or drug misuse, distance from hospital and transportation, health insurance in case of surgery, and in socioeconomic history, we'll ask about domestic violence. About systemic inquiry, ask about appetite, weight loss, weight gain, and fever, bowel and bladder function. If your gynecological complaint mainly will details in this aspect. Ask about detail of each system. Example, in central nervous system, we'll ask about headache, dizziness, changing behavior, loss of consciousness, weakness, abnormal movement. In gastrointestinal system, we'll ask about dysphagia, heartburn, jaundice, hematemesis, constipation, diarrhea, melena, bleeding per rectum. In cardiopulmonary system, we'll ask about cough, hemoptysis, pain, palpitations, syncope, and claudication. In urogenital, ask about loin pain, dysuria, polyuria, hematuria, and urethral discharge. In skin and musculoskeletal system, we'll ask about pain, fatigue, muscle wasting, pigmentation, and ulcers. We represent this history in a summary, in brief summary, and will be followed by gynae examination in the next lecture. Thank you.